All right, this is a child from Alaska. And I've been so fortunate to be able to work with children from around the world. His age, he's almost 5 years old, and he's complicated. This child also doesn't just fit neatly into the category of CAS, but we're going to see that best practices for him are going to be best practices for childhood apraxia of speech.
Do you like to swim? Yeah. I think, wait, are you staying at a hotel while you're here? Yeah, so what do they have at that hotel?
All that I had, and all that I had,
Is there a pool there?
yes.
Oh, so you did maybe get to go swimming?
Yes. And I also have a pool.
Do you know how to swim by yourself?
Yeah.
So do you need floaties? Like, do you need to have floaties on your arms, or can you swim all by yourself?
I'm okay.
Yeah.
But
So mom watches you swim?
no.
No?
It's in the pool.
Yeah, in the swimming pool.
So without a context, I think that we would have a pretty tough time understanding him at all.
Ow. Say ah.
Huh.
Just say ah.
And I don't know if you can always hear, but he adds an H to many words that don't contain them. But one of the things that I did ask about was H one of his goals at home, and it was. H would probably be the last consonant that I would want to work on, especially in the initial position, because it's the most devoiced consonant, and it doesn't match very well with a vowel. It doesn't co-articulate very easily with a vowel. But I think that was one of his goals, and therefore he had overgeneralized it.
Okay.
He has large tonsils.
Just say Good. Say ooh. Say e. Do it again. E.
There's that H.
Say ah. Say eh. Just say eh. Now say eh.
Heh.
Do it again. Say ah. Good. Now Now say ooh. Now say e.
He's adding a consonant
Say it again. E.
prior to the vowel.
Now you're saying T. Say E. And say aw. And say eh. And say eh.
Duh.
Okay. Can you just say eh without a d? Can you go eh? Good try. Okay. Now say I. Do it again. I. O. A. Ow. Do it again. Ow. Oi. Let me hear you say T. Ba. Da. Na. Very good. Let me hear you say mama, papa, baba, boo boo, da da. You did it.
So he's doing something unusual. He's devoicing. Devoicing is not natural. It's not a natural phonological process, but that's what he is doing. So here's a little video of he and his mom, and I'm coaching. One of the things that we're finally working on is front to back and back to front. So remember, alveolar to velar words and velar to alveolar. And when they come up, we want to keep that initial consonant paired with the vowel and possibly segment away that final consonant. So if a word comes up like duck, and he's going to say dut, then we'll prolong that vowel, duck, and then put on that final k, so that he doesn't front or back the entire utterance.
Boy?
They went to the top.
The boy wants to go on top?
Yeah.
Well, tell me.
Boy wants
to
go on top.
There you go. Good.
They're sharing the bed?
Yeah.
Okay, who's sharing the bed? The babies
Are
sharing
the bed.
Babies are sharing the bed.
Yeah.
What? Get up.
So he said det up, So we have to fix that.
Okay, there's that word back to front. Get.
Tell me. Say get.
Get
Get.
Get
Up.
up.
Get up.
Daddy.
The daddy's gonna take a nap in the bunk bed?
And then sleepy.
They're sleepy?
Yeah.
Where are they gonna take a nap?
On him.
On him? On the daddy?
Yeah.
Tell me. On
Daddy.
on the
And
daddy.
then the baby walked ladder down.
The baby took the ladder down.
Okay, there's the word took.
Took
Took
ladder down. The baby.
And here he is. You have to really listen closely because it's not the most loud video of him doing a report on a Siberian tiger at age 8.
My name is Thomas. The name of my mammal is a Siberian tiger. It is a mammal because it has fur, is warm-blooded, and has a backbone. A Siberian tiger weighs 660 pounds. It is 70 to 82 inches long. The Siberian tiger lives in a forest. It can be found in Russia or China. This habitat has pine trees, spruce trees, and swamps in it. A Siberian tiger is good at surviving, has sharp claws and teeth to hunt. It needs to prey on wild pigs to stay alive.
Okay, so pretty severe speech sound disorder at age 5, and he rarely has any type of error, speech motor errors. And he's also reading, which makes him sound a little more fluent than if he were then spontaneously speaking. But did a great job. So isn't it interesting? Here's a child that can produce most of the isolated vowels perfectly well. Vowel-to-vowel movement, just the A was giving him difficulty and a little bit on oi. And then you just add another vowel. And then the whole syllable shape falls apart.
How old are you? Are you almost 4? Yeah, you're 3, but you're going to be 4 in a couple months, right? Yes! Say yeah.
Yeah.
Yay! Gotcha! Here comes another airplane. Let me hear you say bubble.
Bubble.
Mommy.
Mommy.
Baby.
Baby.
Puppy.
Puppy.
People.
Bubble.
People.
Poopy.
Poopy?
Yeah.
That was silly.
And that was that example of overgeneralization.
Let me hear you say daddy.
Daddy.
You got it. Okay, say 1.
Duh.
Say 1. Say 1. Say wa. Say ooh wa. Good. You got ooh wa.
You know, some of our evaluation is about stimulability and trying a few treatment techniques or cues to see what's going to happen with those. And it will help us to make our plan for what types of words we want to work on, what types of cues are going to be best for this particular child.
Do.
Do.
T. Go.
Do.
Now I gave him the 1, 2, 3 go in an approximated way because I wanted him to feel that he's successful as to what I was asking him to say. If he couldn't really say any of the words I was asking him to say, then it would be failure, failure, failure. And so that's why I gave it to him as 1, 2, T. And what you're going to find out, and I'm always happy to let you know what I'm doing wrong. I have learned a lot over the years, and I expect to continue to learn more and more every day. Is that I should be also then modeling the correct utterance at the end of when what I've asked him to do. So if I said uwa, do, ti, then I should say 1, 2, 3, go right afterwards.
Can you say nice?
And that was because he said go as do, and I wanted to know if he could at least get into that velar positioning with like a guttural, and he could. That gives me an idea that I'll probably be able to get a g and then eventually get a word like go. When I think about typical toddlers, I think about how do they start to form words. they don't usually come right out and say bottle, right? Except for the British kids. They might say, Mommy, I want my bottle. But a lot of the kids just don't come out and say bottle like that. And so they may say ba. They may say ba ba. Maybe they understand that there's two parts to that word. Maybe they can get right into bado, and they finally get to bottle, but no one had to teach them. And this is not any true type of hierarchy, it's just examples of how children simplify the motor plans of words right off the bat and do them the way that they can best manage them on a motor level. But the children who struggle to speak don't necessarily go through these simplifications of adult forms of words and get to the full target on their own. And that's where we come in. We need to help them to get to that target. But if we continuously ask children to produce full words and just think that by bombarding them with the full words that they're going to then learn them, it doesn't happen easily, especially with children with apraxia of speech. So asking them to produce full words is setting them up for failure. We need to figure out what is their highest approximation for the target words that we're working on, and then continuously move them to the full adult targets of words, especially words that are important to them. Errorless teaching, or sometimes people say errorless learning. Errorless teaching is a method of cueing before failure. So the technique helps children to emit successful responses on a given goal. There's an immediate prompt or cue that prevents the child from emitting a mistake or error, and thus helps them to practice correct responses rather than errors. Children will be more inclined to cooperate with errorless teaching. So errorless teaching is a lot easier when you're working on something like receptive language. So let's say that you have a ball, a car, and a shoe on the table, and you say, where's the ball? And the child is going obviously to the wrong item. You have time to take their hand and put it on the ball, and then that's a successful response, and then you can reinforce it. You don't want them to put their hand on the shoe and then have to say, not the shoe, the ball, because basically you're just leaving a residue on their brain of an error, all right? My best analogy for that are those of you that still remember chalkboards. When there's an error and you have to erase it with an eraser on the chalkboard, it leaves a residue. And so we don't want the error to occur at all. So if we cue before failure, then we're not really leaving that residue of an error on the brain. And so errorless teaching. So, for speech motor, kind of have to know where is the error likely to occur. Children are really struggling with a second syllable, then you're going to have to cue that medial consonant so that they'll be more correct on that second syllable. If you know they're going to leave out a final consonant, then you'll give them a cue before they even leave that final consonant out. And so it's harder, but we still want to think about how can we cue before failure, and that's errorless teaching. All right, so CVCV is one of those very early and easy syllable shapes. We talked about how it resembles babbling in infants. What are those techniques for teaching CVCV? Sometimes simple consonants are difficult to pair with tense vowels. Moo, moo, nay, nay. We might need to then use neutral vowels, which might be easiest, such as words like mama, dada, papa, or neutralize the tense vowels and diphthongs by doing something like this. Let's say that we say, look at the horse says neigh, neigh. Can you try it? Go nah, nah. Or look, the cow says moo, moo. You try it. Muh, muh. Or woof, woof as wah, wah. Ask the child to say na, na, and then model, yes, a horse says neigh, neigh. Remember that we always want to model correctly. When a child is successful with the desired approximation, they will be more apt to agree to continue to work with you. If they hear you ask them to say nay, nay, and they don't know how to co-articulate the end with the diphthong vowel a, the child may not attempt the word. Remember to model correctly after the child has successfully produced the simplified version of the word. Continue to attempt to gain accuracy of the vowels as you progress through therapy. If you are modeling the full CVCV, and the child gives you only one single syllable, and we talked about this. You say ba ba, and the child only says ba. Bombard the child with several of the same syllables, ba 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 ba, and the child will likely give you two and stop. And if the child gives you multiple syllables, you say ba ba, and they say ba 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 ba. Gently touch their lips as though it is a shh signal to stop after the production of the second syllable of that CV. So let's go back to CV, which we've said might be difficult for kids because in a CV syllable shape, many of the initial consonants are paired with a tense vowel or diphthong, which might be difficult. So it might be more effective to work on repetitive consonants with vowel change in words such as mommy, daddy, puppy, baby. So you can see that mommy has a me in it, daddy has a D in it, puppy has a P in it, and baby has a B in it. And we're going to bridge those to CV. We can do this by reconfiguring the words from CV vowel change to CVC plus V, meaning to present mommy as mom-e, or daddy as dad-e, puppy as pup-e. We're going to practice those vowel change words with this reconfiguration, and once the utterance can be more rapidly produced, we can gain the second syllables to gain me from mommy, D from daddy, to later use for muddy and body, or B from puppy or puppy, and B from baby. Or bubble as bub-o. And we're going to keep working on bub-o until it gets so rapid that we can then get that bo from bubbo, or a po from peepo as for people, and a toe from turtle to turtle. Replacing a final L with an O is the process of vowelization or vocalization. Or a simple bisyllabic like happy could also be reconfigured to hap-e, also for the purpose of gaining P or B. Some of us are working tirelessly on vocal imitation when the child is not ready and therefore unsuccessful. I do a lot of video consultations, and very often I will see an SLP working with a child who's really not ready for vocal imitation, and the entire time they're trying to get the child to imitate a vowel or a simple syllable, and the child is never successful. That would be a very poor idea and not the place to start. How do we prepare that child for vocal imitation? Well, we want to work on gross motor imitation, and we can do that through hand-over-hand support until our cues can be faded, and then move that to more fine motor imitation, to oral motor imitation, and then vocal imitation of a phoneme, syllable, or even full word that we know that is in the child's repertoire or we have heard them say. Additional information about this kind of procedure to gain imitation is through a book called Rapid Motor Antecedent Training, and also Tammy Casper and my Sign to Talk Nouns and Verbs Kits through Northern Speech. That would also be a way to help children to use sign language as a bridge to vocal skills.